This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
So has this ever happened to you? You come inside after spending some time outdoors. Maybe you were mowing the grass, weeding the garden, or watching the kids on the playground. You're relaxing on the couch with a cold drink, and then suddenly you feel something crawling up your leg. You reach down, and the only thing you see is a little speck. But a closer look has you freaking out. It's a tick! As we hear from reporter Alex Jokic, you might want to get used to it this season.
They're creepy, crawly, and thirsty for blood. The little bugs are a big problem this spring.
I've already pulled a couple ticks off my kids, so I can see it's going to be a tough year for that.
Experts say the heavy snowpack this winter may have acted as a blanket for the bloodsuckers, insulating them from the cold.
Pretty much as soon as it gets warm and the snow's gone, ticks can start emerging.
Ryan Kozatek says the one to worry about is the black-legged tick, known for carrying Lyme's disease.
We have seen numbers rise more so since 2012, and their range is kind of expanding from where they used to be. So we used to find them mainly along the lakeshore.
More often, though, people around here get clamped by the less dangerous types. But doctors warn, be careful how you deal with those, too.
What you don't want to do is rip it off and then leave parts of the tick embedded in the skin, and infection can happen and irritation, and it kind of festers for a while. Usually we want to put alcohol or peroxide on the tick and let it release first, and then pull it off with some tweezers.
Don't want to go through all that? Try this.
It may seem a little bit goofy, but maybe the more people do it, the cooler it'll be. Tucking your pants into your socks and then spraying your shoes with an insect repellent.
Well, I have to be honest here, I don't know if I'll be doing that anytime soon, but tick checks are essential. If you can spot and remove a tick early, doctors say there's a better chance the pathogens they carry won't make it into your bloodstream. Lisa and Jimmy, you have more on that.
Well, if it does get to that point and you end up developing Lyme disease, do you know what type of impact that can have on your body? Especially a child's body. The Centers for Disease Control and Prevention reports kids ages 5 to 9 face the greatest risk of contracting Lyme disease. Each year, 75,000 children are diagnosed with Lyme disease. That's 205 kids every single day. It's certainly nothing you want to take lightly.
No. So joining us today via Skype to tell us more about it is Dr. Roberta DiBiase, who's the chief of the Division of Pediatric Infectious Diseases. Thank you, doctor, for joining us.
Thanks for having me.
Let's talk about Lyme disease for just a second. It can really get serious. Tell me about the impact it can have on our kids.
Well, as you know, we live in a region in a hotbed of Lyme disease. But the most important thing for people to know is that it's a treatable disorder. We see lots of cases in children, and even if you're at an early stage or an early disseminated stage or even a late stage, we treat all of those. And if you want to try to prevent it, I think the best thing is to learn about what you can do to prevent the ticks from attaching to begin with, and more importantly, getting them off within the 48 hours so that you're not at risk for Lyme transmission.
Well, as you probably know, we always can't do that. I mean, our kids are outside and everything, and sometimes we might miss them. And you know, children's bodies are always developing. How can that affect them neurologically?
Yeah, so the earliest stage of Lyme is 3 to 30 days after a tick has attached for more than 48 hours. And that's simply a rash on the skin, and there's no invasion into the body. It's simply in the skin. It's a clinical diagnosis, meaning your doctor would look at it, say that looks like Lyme because we live in a Lyme area and it's a rash that's consistent, and would treat you. And you would not do any testing at that point. If it gets beyond that, the child might, or an adult, might have a flu-like illness. So they might have some low-grade fevers. They might have swollen lymph glands in their neck. They might have a headache. They might actually get meningitis, which is inflammation of the covering of the brain, but not the brain itself. They might have a facial droop. Any of these things are considered early disseminated, and again, completely treatable and no neurologic consequence. And then if that's missed, because that'll go away on its own too, if they come in, let's say 6 months later with a big swollen joint, that's the most common thing we see. Again, no neurologic symptoms whatsoever. So long-term neurologic effects from Lyme are very rare. And quite honestly, in 15 years plus here in the DC area of seeing children with Lyme, I can think of one child who's had neurologic, actual brain infection disease, and that was also treatable.
Okay, so doctor, there's some research indicating that maybe chronic Lyme disease actually has an effect leading towards ADHD. What are your thoughts on that?
Well, you know, there's a couple things about that sentence that are a little tricky to talk about. So the term chronic Lyme is actually quite a controversial term. Usually what that refers to is the very small percentage of adults, about 5 to 10% of adults who have had a true diagnosis of Lyme, one of those other things that I just talked about, proven by blood tests and with classic symptoms, who then after their treatment still feel fatigued, have some muscle ache or pain. They may feel like they can't think clearly, cognitive issues. And this has been studied scientifically and has not been shown to be due to a chronic infection with the Lyme germ, and therefore ongoing long-term antibiotics is really not the answer for that. That's actually been studied and it doesn't work, and it makes sense because there is no chronic infection. However, there is a term called post-Lyme syndrome, which is an active area of research. So we do believe that this small percentage, this 5 to 10% of people after appropriate treatment can have symptoms like feeling tired or having pain. But what we think is going on, and the National Institutes of Health is actually formally studying this, is that their body has a very good immune response to the germ. And when you have a very strong immune response, it actually makes you feel crummy. So, so that kind of gets at the first part. The term chronic Lyme is sort of a very emotionally loaded term. Okay. And I want to make it clear to people that there's not a chronic infective state. Okay. Now, the second part of your question was, if you have one of these post-Lyme syndromes, can there be a neurologic consequence of that? And again, as I said, in the adults, 5 to 10% of people who have this post-Lyme syndrome, they might complain of symptoms such as not being able to think as clearly or quickly as they used to. So I think that's what you're asking about.
So do you think there's a link to ADHD?
No, there is no link to ADHD.
Okay.
All right, so we're talking about children and adults. When it comes to adults, what's the main concern or impact that Lyme disease can have on adults?
Well, if it's untreated, you can go on to have, like I said, late manifestations of Lyme disease. So you can have swollen joints that become chronically inflamed and you know, are painful. But if it's treated, there is no long-term consequence. So I think that's the most important message to get across to people. You know, if you go into Google and put in Lyme disease or chronic Lyme, there's a lot of scary information on the internet that's simply not backed up by scientific studies. And I really encourage people, if they want to learn about Lyme, to go to the CDC website, so for the Centers for Disease Control. They have beautiful stuff, not only for physicians who take care of these patients in our region, but specifically for people who have questions, for parents, for adults. They have myths, they have frequently asked questions, so they can get actual scientific answers to these questions.
So what would you have to say to somebody who said they've had a lifetime experience of pain with this?
Yeah, and that's, again, you know, when people, if you go into the general population and you take a survey of people who have pain, there's no increased incidence of people who have pain in those who have Lyme disease or who do not have Lyme disease. So if you live in a high prevalence area like we are, if let's say we went out and took 100 people's blood, we would find a lot of people that have had Lyme at some point in their life, right, may or may not have been symptomatic, and they may or may not have pain. But the problem is you cannot link as a causative thing Lyme causing their pain, because there's just as many people with the same exact symptoms, pain, who don't have Lyme positivity. So that's the tricky part of science. You can't associate something that is associated and make it a cause. And that's where there's a lot of misinformation. I think the other danger of that is that if people continue to attribute their pain to Lyme, and actually many times in the face of not even having any lab tests that are consistent with Lyme, we actually ignore what is really their problem, because there are rheumatologic disorders, there's fibromyalgia, there are muscular disorders, there are other neurologic disorders. So we don't want to make the mistake of attributing every symptom that someone might have due to Lyme that they had, if it was adequately treated with proven antibiotic regimens.
Right. Okay, so finally, PRMC has the ID telemedicine program, which can really come in handy when it comes to things like Lyme. Tell us about it.
Yeah, we're really excited about this, and I'm sure you're aware, you know, across the nation, there is more and more effort to reach out with specialist care to people that are not necessarily in a major medical center, because, you know, people will drive in hours to come see us in our clinic, and we would like to be able to help them in their own communities, but there's just simply not enough specialists that live out in these communities. So with the wonders of modern electronic equipment, we actually have very high resolution cameras and imaging that allow us essentially, for if you were in the clinic at PRMC, we have a nurse there